As takeaway tips, I would have several points. One would be, as you're considering the antiemetic regimen, always look at the chemotherapy protocol and base it on the chemotherapy drug in that protocol that has the highest hematogenicity. The other thing I would recommend is that before you change any antiemetics, if you've put the patient on an adequate prophylactic regimen and you've given them breakthrough medication and they're still having nausea, consider other possible etiologies like gastroparesis in a diabetic, constipation or partial or bowel obstruction, electrolyte imbalances, brain metastasis. Other possible etiologies might be that the patient is having acid reflux or indigestion, and some patients have a hard time differentiating between acid and nausea. So you may want to add a proton pump or an H2 blocker. The other thing is that before you add another medicine, if the patient says that what you've prescribed isn't working, I would recommend that it may sound simple, but it's important to get a complete history. How are they taking the antiemetics? Often they're on multiple new medicines and kind of get confused on how to take them, and so that's an important first step as well. Other considerations are adding another medicine like an anxiolytic if you think that anxiety is part of the nausea process, H2 blockers and proton pump inhibitors, as I mentioned. Consider whether you can increase the frequency or dose intensity of one of those medications that they're on rather than adding another medicine. But you can still add options or change from an NK1 inhibitor to something like olanzapine, which is an atypical anxiolytic. Another thing I would say, I'm a real proponent of collaborative practice, and you're never alone. I would involve your pharmacist and collaborate with them, brainstorm with them on how you can individualize the treatment plan for your patient. And the other thing is there are multiple guidelines out there, and guidelines serve multiple purposes. You can use them to standardize treatment regimens. You can use them for education. You can use them as a resource, obviously, and also they help to improve outcomes. And that's our goal, is to give the patient better outcomes and also reduce the costs to the patient by adding multiple meds, and reduce the costs of healthcare, because if you can get better control on the nausea and vomiting, you're decreasing the number of unscheduled visits, ER visits, or even hospitalizations for dehydration or electrolyte imbalances.